Hello. Thank you for the opportunity to share some of the results of our research. My name is Timothy Bahr. I'm a neonatologist and an assistant professor at Intermountain Health and the University of Utah here in Utah in the United States of America. I'm excited today to share some of the results of our studies that we've done on the Picterus Jaundice Pro app on inpatient infants as part of our efforts to determine the decision accuracy of these smartphone-based technologies. So briefly, I'll start with an introduction and methods. Right now in the United States, jaundice management is very clinic and physician-centered. Every baby in the United States is recommended to have a total serum bilirubin or some kind of transcutaneous bilirubin measurement prior to discharge from the birth hospitalization. If the baby has a bilirubin that's high enough or is suspected to have jaundice later on, in order to evaluate that infant, the infant needs to return usually to the clinic or to a hospital laboratory, be seen by a physician or another provider. We think that perhaps a better way to manage jaundice would be a home-centered and a physician-supported approach where the parents can manage the jaundice and the simple problems that the baby may have at home while being monitored by a physician or a nurse or a healthcare professional remotely over the phone or over technologies that allow them to communicate with those professionals. So certainly this takes some new technologies, and the technology that we're studying, discussing today is the Picterus Jaundice Pro app. So we're grateful for the opportunity to partner with Picterus, and we conducted an inpatient bilirubin decision accuracy study of the smartphone-based estimation of serum bilirubin that's done by the app. This was a gold standard comparison accuracy study that was funded in collaboration with Intermountain Health and Intermountain Ventures, a venture arm subsidiary of Intermountain Health. The goal of our study was to determine the accuracy and the decision accuracy of the Picterus Jaundice Pro app in newborn nurseries and NICUs at 3 large hospitals in the United States. And what we did was we obtained Picterus measurements within 1 hour of a clinically ordered total serum bilirubin. This was only done on inpatients, and we had 4 groups that babies fell into. We measured bilirubins and Picterus estimations on babies who were greater than or equal to 35 weeks and those that were less than 35 weeks. And we did it in groups of babies that had not received phototherapy, and we also did it in babies who had already received phototherapy. This study was approved by our Institutional Review Board, which is the regulatory human protection and privacy board in our hospitals. And we did have informed consent from all parents of infants who participated in the study. And we had a great performance in our enrollment. The first baby was enrolled on February 12th, 2024. The 400th measurement was made just 3 months later on June 11th, 2024. Midway through the study, we realized some issues with our data set, particularly that there was underrepresentation of certain races and ethnicities, and probably of certain skin tones in the populations that we serve in our hospitals. And then we also had an overrepresentation of babies who are around 24 hours of life, because that's generally when physicians order the first bilirubin. So we made some amendments to our IRB proposal and to our protocol that were approved to allow us to increase infants who were in both of these groups. Enrollment concluded on October 1st, 2024, with 473 measurements on 291 babies. Now I'll discuss some of our results. For simplicity, I'll only present the results of the babies who were born at greater than or equal 35 weeks gestation and who had not received phototherapy, because that was the primary aim of our study. On the left, you can see a scatter plot where we plot the total serum bilirubin, which we consider to be the gold standard in our study, against the smartphone estimate. These values are in milligrams per deciliter, which is about a 17th of millimoles per liter. So you can multiply these by 17.1 or just 17 simply if you're more used to millimoles per liter. And as you can see, most of these dots fall right on the line of agreement, which is the dotted line, and sometimes above the line, which would represent overestimation. On the right is a modified Bland-Altman plot, where on the x-axis is the age at measurement in hours of the infant. And then on the y-axis, we measure the bias or the error, that is the smartphone estimate minus the total serum bilirubin. And here you can see that especially in the first 100 hours of life, or we say about 96 hours of life, device is very accurate and has minimal bias. As the baby ages, it becomes slightly less accurate, but it does so in sort of a safe way in that it overestimates the total serum bilirubin. So in total, we measured 246, had 246 measurements in this group from 215 infants. The Pearson correlation coefficient was 0.88. The median bias was very close to zero, as shown here. And 197 or 80% of our measurements were within 2.0 milligrams per deciliter, or you could say 34 millimoles per liter. We thought it was important to compare the performance of the Picterus Jaundice Pro to other non-invasive devices that are currently available in the United States. Those two devices are the Philips BiliCheck device and the Draeger JM105. Of note, the Philips BiliCheck device is no longer being manufactured and is no longer being supported, so we've seen a decline in its use over time. And the Draeger JM105 is the primary device that's being used in hospitals that utilize non-invasive measurement. I think it's important to realize the logistical advantages in comparison to these other devices. The Picterus Jaundice Pro app is sometimes even less than $1 or $2 per use US. It's automatically updated and calibrated, whereas the Philips BiliCheck device and the Draeger JM105 cost thousands of dollars US, and they require daily calibration and servicing every 6 months. The Pearson correlation, as I reported previously, for the Picterus Jaundice or for the Picterus Jaundice Pro was 0.88, which approaches that of the Philips BiliCheck device and is right in range of the studies that have been done on the Draeger JM105. The root mean square error is slightly higher for the Picterus Jaundice Pro app at 2.46 milligrams per deciliter compared to these values for the other non-invasive devices. I will note that when we limit the data set for Picterus to the first 96 hours of life, it does approach these two values at 1.7 milligrams per deciliter. And the number of values that are within 1.5 milligrams per deciliter, as reported in the literature for the other devices, is very similar to that of the Picterus device or the Picterus Jaundice Pro app. We thought it was important that the device functioned well across race and ethnicity and skin tone. We observed that there was no statistically significant difference in the smartphone minus the difference in the smartphone estimates minus the total serum bilirubin estimates between parent-declared race groups. So they were very similar, or at least the bias was very similar across all of these races and ethnicities. We also looked specifically at skin tone using something called the R channel value, which is basically the red component of RGB color descriptions when a photo is taken of the skin. And so, as you can see here, we plotted the R channel across parent-declared race and ethnicity, and as expected, there certainly is a difference in the R channel values across these parent-declared races and ethnicities. The good thing, though, was that we did not see a difference between smartphone, the difference between smartphone and TSB, that is the error or bias or difference in the device, was not associated with skin tone. So it didn't matter if your R channel was high, which represent generally a lighter tone of skin, or your R channel was low, R channel measurement was low on the infant, which represents darker skin tones. The bias or error of the device was not associated with that R channel value, suggesting that the device functioned equally or roughly equally across different skin tones. The last thing that we measured was something called decision accuracy. In the United States, we use phototherapy thresholds that are defined by the American Academy of Pediatrics. One of the most important questions we have that if we were to use Picterus as a screening tool in our hospitals or in the home for babies, for infants in the United States, what is the risk that Picterus screening would fail to recommend phototherapy for a neonate who would have qualified for it if we were to use total serum bilirubin, the gold standard screening? And here are the results of that analysis. Of the three infants whose total serum bilirubin qualified for phototherapy or exceeded the phototherapy threshold defined by the American Academy of Pediatrics, all three of those uh, Picterus values or the Picterus values estimates for those three infants also exceeded that phototherapy threshold. So the correct decision was made. Sort of conversely or likewise, depending on the way you look at it. Those babies who had a total serum bilirubin that was more than 2 milligrams per deciliter below the phototherapy threshold, the Picterus value also aligned with that. But the one we're most interested in was this right here. Were there any babies where the total serum bilirubin said you needed to start phototherapy, but the Picterus would have said you didn't need to start phototherapy, or maybe less harmful would have been, oh, it's close to the phototherapy threshold. You should double check a total serum bilirubin. And so we concluded that using the 2 milligram per deciliter as a cutoff for additional testing, that is a total serum bilirubin, the Picterus device makes an accurate decision 100%, or in our data set, 246 out of 246 tests, the accurate decision was made 100% of the time. So in conclusion, the Picterus Jaundice Pro app is a safe technology for screening infants for hyperbilirubinemia. The Picterus Jaundice Pro app is an accurate technology for screening infants for hyperbilirubinemia. We do believe it has many advantages over blood tests and other non-invasive measurement technologies, and that the Jaundice Pro app has great potential to transform the way that we manage hyperbilirubinemia worldwide. Thank you for your time, and I hope to have more interactions with people who are investigating this space. Thanks.